The good news is that we have improved over the 40 years I've been involved. There has definitely been an improvement. A survival now 5 or 6 years would be a typical survival for a woman with ovarian cancer. The bad news is that it is still usually fatal, and so we have to improve treatments. And the way to do that is to understand the disease better and to develop what we would call targeted treatments to understand why certain ovarian cancers need treating in certain ways. The one that we've been involved in most is something called a PARP inhibitor, poly-ADP ribose polymerase inhibitor. And that's based on the information that we now know that a significant number of women with ovarian cancer have an inherited disease related to a BRCA1 or BRCA2 gene, and these render the cancer cell particularly susceptible to this kind of treatment, the PARP inhibitor. And it's been a great privilege for me to be involved in the development of that from the early days, the laboratory work in our institute some 11 years ago. Now these drugs have gone right through to randomized trials and have become established as what we call maintenance treatment. That is, delaying the time that a treatment is needed for recurrence, because the disease does keep coming back. And we're making progress, we hope, in understanding how to combine these with other treatments to get at problems of drug resistance. So that I think targeted treatment in ovarian cancer is becoming a reality. It's likely that these will have a role actually beyond women who have the BRCA mutation. There may be another population, just as many of those, that may benefit. So roughly 50% of women with the commonest type might be candidates for PARP inhibitors. In terms of other targets that we're looking at, another thing that I mentioned which we're very hopeful about is something called the alpha folate receptor. It turns out to be highly expressed in ovarian cancer, a very good target, and we've developed a drug which just specifically targets this receptor on the cell membrane in ovarian cancer called ONX-0801. And we've seen responses already in several patients. So this is now going into a trial in several sites in the UK. And that's different to PARP inhibitors and BRCA mutations, but we're very hopeful.